Hi, my name is Josh Tennant. I'm going to talk here briefly on this video about my approach to bunion treatment, both operative and non-operative. This will kind of take us briefly through, hopefully you don't get too nauseated watching this Prezi as it takes you around the screen here. This is a picture of a bunion. Certainly people wonder, why did my bunion happen? And constricting footwear is a linked cause. Not everybody has to wear 6-inch stilettos to get a bunion. There are other reasons why you will be prone to get them, including hereditary factors, having pes planus or flat feet, and also having generalized ligamentous laxity will cause the soft tissue structures to let your toes go into this position. The reason for treatment of a bunion is for pain relief and for improved physical function. If you have a painless bunion, it's typically going to be one that we try to treat in other ways other than surgery. The ways to treat things without surgery include wider toe box shoes, ball and ring shoe stretchers that allow your shoes to fit more comfortably that you already have, as well as splints or spacers. Now, when surgery becomes the option that we're looking at, there's some things that you need to think about before we go down that path. You'll need to think about the timing, namely the time of the year that you want to have your surgery done, particularly if you have other events going on in your life. Having surgery in your foot will slow you down. Even if you can be putting weight on it within a week of surgery, it's going to make you not as active. Talk to your insurance company. The most common surgical CPT code is 28299. It's important to understand your copays and what's going to be involved with that. And then plan for an office visit with me within 30 days of surgery. That's a kind of a system requirement for making sure that you're healthy enough right before we do surgery on you. And also we can answer any questions and do some final paperwork. Briefly, the technique of doing this surgery, there are multiple types of bunion surgeries. Historically, there's been about 130 described types. I tend to focus on one type that gives me most of my corrections for most people. I certainly probably practice in the range of doing the options of between 10 and 15 different types of surgeries for bunions, but the scarf osteotomy is really the most common approach that I use for at least moderate and severe bunions. To look at that in a diagram, this is from Coughlin, Mann, and Saltzman, the latest version. It's a osteotomy on the metatarsal that creates a step cut that allows you to both rotate and slide the bone and then fix it with 2 or 3 screws. The screws are 2.3 millimeters, made of titanium. They're going to be about the size of the ink cartridge on a ballpoint pen. So they're pretty small. Airports will not pick these up in their current technology of the current scanners, at least. And like I said, there are other types of surgeries that I do. I would typically also do an Aiken osteotomy, which is a proximal phalangeal osteotomy. You can see that here in this one example of a patient recently done who's doing well. You can see that the scarf osteotomy is this part right here on the first metatarsal. The Aiken osteotomy is right here. This person got 4 screws instead of 3, which is my most common number, 3 screws. And this is the Aiken with 1 screw. And then also an associated procedure was a hammer toe correction, which is a common occurrence with the bunion. And required 1 screw, as well as a reconstruction of the soft tissues under the second toe joint. Sorry about that. Anesthesia is typically going to be an ankle block used with local anesthetic, so lidocaine and marcaine or bupivacaine, and that gives relief during the surgery as well as about 8 to 12 hours afterwards. Sedation is given, as well as we call it LMA, or laryngeal mask anesthesia. generally not intubating people for this type of surgery. Lastly, the recovery. You can begin weight bearing the day after surgery. With most of the types of bunion corrections that I do, your weight bearing is going to be probably more on your heel and your lateral forefoot or over your fifth toe, but the scarf osteotomy is stable and strong enough to withstand weight even in the first week after surgery. You'll be more comfortable though with crutches, certainly for a couple weeks thereafter. Medications, we do a multimodal pain regimen that includes Tylenol, oxycodone, gabapentin, anti-nausea medication, and vitamins and minerals to promote your healing. And for long term, you can expect to be doing heavier activity as early as 3 months, and that's, there's no limitations as far as weight bearing, but your symptoms are probably going to limit you from really being active for at least a few months. And you may have some persistent swelling for months after that, but it's going to decrease over time to the point where between 9 and 12 months is where you really expect to have a normal appearing foot, although it's a very gradual, slow process that gets you there over the months after the surgery. So that's my approach to treating bunions, and thank you for your time.